matter how hard we try to eat healthy and exercise, it is still really hard to fight aging and gravity. But there is nothing wrong with getting a little professional assistance, especially with all the talent and technology that is available right here on the Suncoast. Dr. Manik Bedi of Tampa Surgical Arts is here to talk about different trends we are seeing, even with some of our senior friends. Great to see you, Dr. Bedi.
Yes, thank you for having me again.
So we all try hard to keep it together as we age, but I like the fact that technology is really helping us out, and technology that you are able to utilize right here on the Suncoast. Talk to me a little bit about body contouring and what people are asking for when they come see you.
Yeah, it's a great question. So body contouring is the most commonly requested service that we have at our facility. So what we specialize is in minimally invasive body contouring using all hidden entry points to help tighten and rejuvenate the skin.
Okay, so that means I'm not getting cut wide open and I'm not going to be down for weeks on end. Define minimally invasive.
Yeah, exactly. So minimally invasive means we use tiny hidden entry points, typically in the armpit area, the belly button, and right above the groin area, and same thing on the back side, armpit and right above the buttock area. And that's for total body contouring lipo 360, where we contour armpit to above the groin on the same on the backside, armpit to right above the buttock area.
Okay, so let's take a look at some pictures on how successful this is, and then tell me, because you're using these minimally invasive points, I'm assuming that means my recovery is a lot easier.
Yeah. So we find with most of our clients have about 2 weeks of social downtime. So this beautiful client came to see us. She actually had body contouring or liposculpture elsewhere. She came to see us for a revision, meaning we had to recontour the areas. She's in her mid to late 40s, and this particular woman, I loved her story. She actually came to see me, and every time I would see her afterwards, she was in her gym clothes working out, and verbatim what she said to me, if I'm going to invest in this procedure, I'm going to invest in myself afterwards.
That's smart. So it kind of motivates you.
Motivation, 100% motivation.
Okay, and mid 40s, not too old, not too young. Is there a top where you try not to do this type of work?
Yeah, we typically try to focus on clients who are living a healthy lifestyle. So we confer with their primary care to make sure they're healthy enough to have the procedure done.
Yes.
Again, this client here was in her mid to late 40s, and that's probably our average clientele that we're seeing doing total body contouring. She's seen about 1 year out in the after photos where we contoured everywhere from her armpit to above her groin area. Same thing on the back side. This client particularly different, where we added volume to her buttock area. We did fat transfer to the buttock, which is Brazilian butt lift, BBL.
And so if someone happens to be over the age, or maybe to a point where you're not comfortable doing complete body contouring, there are lots of other options. So let's talk a little bit about the Botox trend. Not new to me, to lots of people. It's been around obviously for a long time, but you're seeing more men doing it and more seniors doing it. Tell me about that.
Yeah, so super common in our facility to see men and people who've never had Botox or neuromodulators in the past. So we're calling this now Boomer Tox, so people who are in their 40s, 50s, 60s who have never had any other treatments done.
Right.
And we're doing Botox, which is a neuromodulator, to help get rid of dynamic wrinkles, meaning wrinkles that you can make. So this is the before and after of someone who had Botox. Typically, we're seeing results start as soon as 1 week and lasting a couple months afterwards.
And that certainly then I would think gives you an overall younger appearance if you're not creating wrinkles every time you make a movement.
Absolutely. So the analogy I like to give all my clients is if you take a piece of paper and you keep folding it, you get that permanent dent or crease. So we're stopping that folding of the piece of the paper by using Botox or neuromodulators, so that skin doesn't fold as much, you don't get that permanent dent or crease.
So even if you are older and you may already have some creasing, it can still be stopped.
100%. Yes, absolutely.
All right. And again, not all options at your office involve a lot of downtime. You're also doing a lot of laser work.
Yeah, so at our fully accredited surgery center, we have a med spa facility, and I really do think we have the Bentley of all lasers. So here we're showing the Halo treatment. So this typical treatment, this client's awake, tightens the skin, rejuvenates the skin. We have some of our therapy that has downtime as little as 1 day or less, and some more therapy that has more tightening, has downtime about a week or two. So you have tons of options, and especially being in Florida with all the sun, this therapy that she's using right now helps with pigmented lesions, dark spots, so really game changer in our practice.
And you know what? Everything we've talked about involves those same great buzzwords, minimally invasive. So it sounds like downtime is minimal for all of them.
Yeah, very short, some as short as a day and some up to a week.
All right, lots of different options, certainly applicable to all age groups, and we always appreciate hearing about the latest and greatest with technology.
And you can learn more at tampasurgicalarts.com.